Hello, everyone. Thank you so much for coming to this conversation today. Teletherapy tips in this program is in honor of both Mental Health Month, which is the month of May, and Choose Privacy Week, which is the first week in May. To introduce you to the folks who are speaking right now, my name is Aola White, and I'm the Emerging Technology Librarian at the Jersey City Free Public Library. And I will be speaking to Lazora Jordan, who is a counselor, a social worker.
Hi, everyone. So I am a social worker, psychotherapist, mental health clinician. Those terms are interchangeable, and I'm sure we'll be going into that a little bit more shortly.
Yes, thank you for explaining that. Yes, so I realized this first link I forgot to include. So this explanation of COVID-19 and telehealth, the resource that I would suggest is the Health and Human Services Department of the US government, which is hhs.gov, so hhs.gov. So that's where I got a lot of this information, and that you can dive more deeply into the legal policy related to these kinds of things. I just wanted to give a very, very general, brief overview. So as many people have been aware, whether they've experienced it themselves or have just heard people talking about it, telehealth or telemedicine is becoming a lot more widely covered under different health insurance plans, including for Medicare and Medicaid, and in large part because of the pandemic and the need for social distancing, the need for not for having options that don't require people gathering indoors, especially as health workers have been, having to deal with treating so many patients. So this extends to teletherapy for mental health workers. A conversation or a topic that you'll often hear when you're discussing health services is whether something is adheres to HIPAA or is HIPAA compliant. So HIPAA stands for the Health Insurance Portability and Accountability Act of 1996. And this act outlines responsibilities for securing personal health information. And it also sets guidelines for the platforms that can be used for different types of telehealth appointments. So you'll often see for, let's say, a lot of these apps that have come up in recent years, such as Talkspace or Ayana Health, that will say their platform is HIPAA compliant. That's what that means, is that they're whatever way that they're connecting patients to their providers is a secure platform that has higher security than, say, Zoom or Skype. So with that little background out of the way, I also would like to mention that the Jersey City Free Public Library has a full-time social worker. Her name is Jessica Campbell. At the time, she's available for in-person therapy at the Five Corners branch. So that's a resource that I want everybody to be aware of going into this, if this sparks your interest. Okay, so my first question for Lazora, please tell us a bit about your background and how you became a therapist.
So my personal background is that I have a bachelor's in Africana Studies from Mount Holyoke College. After that, I worked for several years in the corporate world doing hiring in human resources, and eventually decided to make a career change to become a social worker and start being a psychotherapist. And so in order to do that, I went to college at University of Maryland, Baltimore School of Social Work, and got my master's in social work. It's a 2-year program. And upon graduating, as is the case for many people who do social work as a profession, I decided to take the LMSW exam. LMSW stands for Licensed Master Social Worker. And in New Jersey, it's LSW, or licensed social worker exam. You have to pass that exam and also apply for licensure with your state board. And so that was the process that I used to become a therapist. For people who go into social work school, you have 2 years of training that involve classes on clinical information, clinical really being things that tie to skills that you're using in therapy, but you also get information on how to look at the person in the environment, which is one of the defining features of a therapist who is a social worker or someone who is in the social work profession and works in other capacities.
So just also a clarifying question for people, because I think that sometimes people will confuse these terms or think that they're the same thing. What is the difference between a psychiatrist and a psychologist?
That's an excellent question. So a psychiatrist is a medical doctor. There's someone who went to medical school and got training specifically for psychiatric care or mental health care. A psychologist is someone who has a PhD. And so they have a more research focused and they're going to study psychology as their primary field rather than take a medical perspective primarily. There's also something known as a PsyD, and that's a doctorate of psychology that is closer to somebody who has a psych doctorate, but that person has less emphasis on the research background. Psychologists are able to do all kinds of testing. Psychiatrists can prescribe medication. Typically, there's not an overlap between the two in that. PsyD or a psychology doctorate professional also is able to do testing similar to a psychologist. And those are psychological assessments, if that helps clarify things a bit.
Definitely. Yes, thank you. So next, was there any special training that you had to pursue to provide teletherapy specifically, separate from your other therapy training?
No. So when you're doing teletherapy, you still have the same HIPAA compliance standards as you do when you're meeting someone in the office. In the midst of the pandemic, a lot of practitioners, a lot of organizations or platforms that are providing therapy have had to make a switch very quickly to providing teletherapy for the safety of everyone. And as much as you can possibly imagine, doing therapy through a video call or doing therapy over the phone, which is a little bit more rare, can be very similar to meeting someone in person. Each individual's experience and preferences may vary around that. Some people may find it easier to do teletherapy because it works better with their schedules or because of other challenges that they're dealing with. For others, it may not matter, but for some people, it really does make a difference to be able to see someone in person. And that's something to consider, as well as safety guidelines continue to open up with everything opening due to the pandemic.
And at this time, all of your appointments are teletherapy, right?
That is correct.
Cool. What are some examples of goals that potential clients may want to work on in therapy?
I love this question. So you should really set goals with your therapist in a way that's unique to your desires and wants. A lot of people, for example, deal with depression and anxiety, and so may want to find some tools and strategies for managing those things. Other people may have a history of trauma and may want help with processing that trauma. Some people also use therapy for other methods, right? So sometimes they want to be able to pursue certain goals in their careers or be able to pursue certain personal goals. And therapy can help with that as well. Absolutely, what should take place, no matter what your goals are, is that it's a collaborative process between you and your therapist.
Cool. So actually kind of on that note, I know I keep coming up with, with these follow-up questions, but I sometimes see, for example, life coaching, that some therapists offer life coaching. How does that differ from therapy?
So therapy is something that you have to be licensed for in order to do. Most states will have their own state by state licensure process. Life coaching, that takes a different set of credentials, and the two can certainly overlap. Now, the thing that comes with therapy is that you have to provide what are oftentimes evidence-based interventions. And that means essentially that there have been studies that have been done to show that these certain methods or techniques that a therapist is using are seen as effective by the people that they have worked with. And you do have therapists who only do evidence-based practices. You have therapists that use evidence-based practices as well as other practices, such as working with people around their spirituality and the like, some things that are a little bit harder to study. I always recommend in looking at a therapist and finding someone who's a fit for you, checking to see if that person is using evidence-based practices along with other things that you may need. If you're seeing a life coach, that doesn't necessarily have to apply. But if you're doing life coaching with a therapist, there's a good chance that they'll incorporate a mixture of things.
Awesome. Thank you for clarifying that. So for those who are new to therapy, what is the typical process for getting a therapist? What factors might a potential client want to consider when deciding between options?
So there are different ways to find a therapist. A lot of people may decide to call their insurance company or go on the insurance company's website and see a recommended list of providers. This way, you know for sure that whoever you're contacting has, and whoever's open to taking on new clients, is somebody that will take your insurance. Psychology Today is another good resource where you get to read the profile of the therapist and be able to see, are there, for example, certain populations or issues that they work with? Are there certain techniques that they take in their approach to therapy that feel like that would be a good fit for you? Other people may go to some of these platforms that are popping up, so they may decide to go to a space like Talk Therapy or go to ZenCare and look for a therapist that way. Other people may just do a simple Google search of therapists near me. There's really no wrong way to look for a therapist. What I really recommend is, give it a few sessions when you meet with someone to see if that person's a fit for you. Therapy it's very process oriented, and so a lot of times it can be helpful to to give things a little bit of time to see if it feels right for you. But that doesn't necessarily mean that you won't maybe have one session and feel like, okay, well, maybe this person's not a good fit, and that's okay. It doesn't mean that there's anything wrong with you or with what you're working on. And that doesn't mean that there's anything wrong with the therapist. It's highly individualistic. And having someone who's the right fit for you is essential to that process. So, for example, if you're somebody who wants a therapist that is going to be sensitive to your culture and have a cultural awareness, you can always bring up those kinds of questions in session. If you are someone who's a member of the LGBTQIA community and you're looking at a therapist profile, you may see, okay, well, does this therapist work with questions around gender identity or sexual orientation? Is this something that they highlight in their profile? Does this therapist highlight, working around issues of spirituality or religion, or working around things like therapy, working around things like marriage and family and what role that plays. Really, there's a wide variety of options out there. And yeah, I encourage folks to explore.
Yes, I would also second Psychology Today, because you can really use a lot of the different selectors and say, you can prefer the gender of your therapist, or like their approach, their therapeutic approach, or their modality. Yeah, it's really good resource. So my next question, which I think is my last prepared question, is how do therapists protect client confidentiality? Are there different considerations for in-person services as opposed to services through teletherapy?
This is also a great question. So going back to the HIPAA law that Ayola referenced earlier, HIPAA is a law that all health professionals have to follow. If you call an ambulance and they treat you, they have to be HIPAA compliant. If you go to your doctor's office or go to the hospital, they have to be HIPAA compliant as well. So as mentioned with teletherapy, therapists who are licensed absolutely have to make sure that they're using a HIPAA compliant platform. So for example, Zoom has a separate platform that they use that's HIPAA compliant. Other therapists may use an electronic medical records platform. Some people may have a different platform that they're using if they're going through something that's a bit more group oriented, like Talkspace. So when you're meeting with your therapist in person, some therapists may write notes on a piece of paper. And usually if they're doing that, they also have a shredder. A lot of times people these days are doing things electronically, and there's any sort of note taking or documentation is entered into that system that has to be HIPAA compliant. And so therapists will make sure that they have a login and password that has to be used so that people can't just randomly access the computer, or any sort of filing or information is in a locked room that people would not regularly have access to. And so there's, in terms of confidentiality in person versus not in person, something people may see if they meet with a therapist in person is there these little round machines that sound like they're blowing air at the bottom of a door, and that makes noise, and that's to make it that much harder to hear if somebody should just happen to pass by that door of the conversation, and usually you can't hear what's happening there. Therapists who are working at home like myself make sure that they're working in a secure location. There's a reason why I work with headphones, and that I work in a room away from anyone else in my household. And the same I'm seeing with other therapists who are doing teletherapy as well.
Thank you for that very thorough explanation. So yes, so now is time for questions from the audience, if there are any. Yeah, I really appreciated the very succinct answers that you gave to all of these. I feel that as more and more people seek mental health resources, it's definitely something that's going to need to be more accessible, and that includes teletherapy, obviously.
Yeah, there's been a shift with this pandemic. You know, as you mentioned, there are more and more cases where insurance companies or agencies, essentially organizations that provide therapy, are doing teletherapy. More states that are providing licensure or overseeing mental health compliance are also looking at providing more teletherapy, and accessibility is a huge deal. And so my hope is that, you know, that things will continue to be available through teletherapy, because it does work for a lot of people. You know, if we consider issues around transportation or childcare or other kinds of accessibility, it's really important that their teletherapy be available for folks. And I think that's just going to continue to open up, as well as, you know, there will be continued considerations on how can we make sure that we're ensuring privacy and confidentiality of these services when they're being rendered.
So we have a question in the chat that says, what do you feel are the biggest barriers people face while seeking therapy?
Yeah, that's a great question. I think that there's a lot of stigma, unfortunately, in our society for mental health, and people think, oh, that there has to be some sort of majorly identifiable way that they stand out, or that somebody has to have some serious hangups in their life to go to therapy. When oftentimes I describe the process of going to therapy as something that, most people would benefit from at some point in their life. Doesn't mean that everyone would be in therapy for the duration of their lives. No, some people, maybe that's the care that they need. And other people may go for a temporary period of time. But really, going to therapy should be no more stigmatized than going to your medical doctor for a health checkup. People think that, well, if I'm just trying to learn more about myself, can I go to therapy? Is that something that I can work on? Yes, absolutely.
Yes, on that note, I think another thing that people fear, often I think because they're not aware of like the legal parameters in place for therapy, is they think that somebody's going to find out, like their boss is going to find out, or their family members are going to find out who they don't want to know, or they want to control like when the narrative happens. Um, I remember, I don't know if you ever watched the show Malcolm in the Middle. Oop, I did not mean to advance that slide. There was an episode where the main character, Malcolm, um, he pretends that he needs to go to therapy to like the school counselor, and like he's reading all of these psychology books to like come up with reasonable things that like would necessitate him being in therapy. And then the therapist towards the end of the episode tells his mother that he was doing that, which I think therapists aren't supposed to do, right?
That's a great question. So, when it comes to the treatment of a minor in therapy, there are things that therapists will not tell the parents, but parents oftentimes need to consent to therapy, and a lot of therapists will seek what's called assent from minors. Basically, it's important that therapy is collaborative, and saying, like, okay, for the person who is in therapy, are you on board with what's taking place? So in New York, for example, there is a law around the rights of minors. And not everything that a minor does or talks about in therapy can be revealed to parents. And in fact, someone may even be able to see a therapist and that not show up in billing for insurance. New Jersey has its own laws around that. And so I always recommend, if you're a minor who wants to go to therapy, having a conversation, if you feel comfortable with your parent, about what that may look like. And then definitely, when you are in the privacy of the space with your therapist, having conversations about what sort of boundaries you'd like to have. Your therapist should be checking in regularly about, if there's anything you would like to have communicated with your parents, what would you be comfortable with being said, and what would you not be comfortable being said, because confidentiality still is important in that area as well. There are very few times when confidentiality has to be broken. And in most states, this is going to be if there's talk of somebody coming to harm. Usually that's a conversation you can have with your therapist beforehand to see, okay, if I bring this up, is it the case that confidentiality may need to be broken, and you're able to develop a plan that feels comfortable for you. So definitely lots of conversation.
Yes, thank you for that great answer. So if there are no further questions, then I think that we can probably go ahead and wrap up. But just so everybody knows, so this is, as I said, part of Choose Privacy Week. So we just did the teletherapy tips for today's event, and tomorrow we have two events. One is for kids. It's the Fun Fridays program that's actually going to be talking about privacy issues as they relate to kids. So feel free to tune into that. These are all on our calendar, which is jclibrary.org/calendar. And then in the evening, we have a documentary called Coded Bias, which is about the about facial recognition software and how that has racial bias and gender bias involved in it. There's also going to be a director Q&A right after with the director.